Hello, hello, hello. How are you? How is everyone? I just want to check my mic. Thank you, Miss Mills. Miss Mills said, "Hey, my mic sounds nice." Thank you. Hello, 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 everyone. Welcome to week 11. Hello, Mr. Sandeep, Ms. Mills. I don't know if Miss Haley's in here, but I bet she'll be here soon. I see Miss Beth. Hello, Miss Beth. Star Wars girl. Hi, Miss Haley. I see you now. Vina D. You know what? A special shout out to Vina D. She just got her CPC outstanding. So everybody shout Vina D out in the chat. And Vina, if you have any tips or just any words of advice, definitely shoot it in the chat. Okay. All right, we're ready to rock and roll. This is week 11. And if this is your first time here, let me tell you that the purpose of this class is not to instruct. No, we are here to hold you accountable, just to kind of pace you and keep you on your syllabus or the agenda, right? We want to be more accessible to you to answer any questions that you have. That's why we have a lot of instructors in the chat and interns. They're very qualified as well. We want to review what you should already know. We want to give you tips if you need them on how to navigate your course, right? And most important, we want to point out those key guidelines. Indeed, we do. Now, the announcements are the same. No new announcements. Essentially, this is not the AMCI MCDC course. A lot of people think it is. It is not. The YouTube course is essentially a course with all of our YouTube lectures. We meet in this guided session weekly at 12 noon Eastern, 11 a.m. Central, and 9 a.m. Pacific. All right. So the announcements are the same, but I do want to remind you to attend Friday. This is tomorrow. Attend Mr. Sandeep's CPT YouTube session. It's gold. Those reviews are coming in, and he goes more in depth in the coding. He does. He explains it more. Our goal today is not to kind of explain. I want to kind of just do what I said. You know, do what I said. That's all. All right. So, if this is your first time, go ahead and put it in the chat. Let me know if it is. And I'm going to still talk anyway. And I'm just going to say that if this is your first time, go to the website, www.amci website, click on that YouTube course button, and then complete the enrollment form and obtain your syllabus. Follow the syllabus in order. Now, to come to these classes from your syllabus, you can find this attend classes, and then you'll see all of the links. Just click on them. I would click on all of the sessions, register for them all, and you do it, and you'll get your reminder at least 1 hour before. All right. So after you click the link, sorry about that, you'll see this screen. Click on that notify me button, and that is your RSVP. That's all you have to do. And while you're at it, make sure you give us a like up and also click the notifications button too. So when we have other videos, it'll notify you. Mr. Sandeep, if you could take that, I don't know how to take that off the screen. Well, I do, but I have to kind of fiddle around. So if you can, that'd be great. Thank you. All right, so just so you know, the textbooks are on your syllabus, but for this class today, you're just going to need your CPT professional. Yes, but for this session, you're going to need CPT professional, HCPCS level 2, and that MCG. MCG, if you don't have it, you don't necessarily need it, but it definitely is helpful. And we do show you how to work around, how to find the guidelines too. And I'll be doing that today as well. Also, you'll need the Bucks step-by-step textbook. only the textbook, and you will get the AMCI discount. So if you click that link, you should get it for a cheaper price. All right. Also, Discord. A lot of people say, do I have to join Discord? You do not. But it's great. There are additional resources in there. If you don't have the AMCI Gold course, online course, then yeah, you probably should go into Discord. But Discord is so cool because the instructors and interns are in there. And from what I understand, they're getting ready to start some really nice stuff. Also, in Discord, you can attend um, IMTAP. IMTAP is in Discord. Also, there's one more thing. Oh, Friday Night Live. That's another class. And then the instructors are in there to answer your question. Now, it does cost $2.99 per month, but I think it's definitely worth it because not only do you get Discord, you get some private lectures too, which I'll show you later on. Okay, let's see what else is going on in my screen. I think this hasn't happened before, but here it is. All right, so this is what you should have completed. It's, these 13 items. And if you did, then you're ready for the session. If you did not, then you might have, you might want to revisit. You might want to go back and finish. Okay? But just want to point out that these green hyperlinks, these are playbacks. They're playbacks from previous instruction. When we did the full 16-week course before, that's when we were instructing. And also the playback from this session will also be on the green link. So as you can see, this purple and this green will indicate that it's a playback, and we put it at the end of your video series. Now, I do want to tell you that this is a replica of the playlist, the YouTube playlist, meaning these are all of the lectures. Let me be very clear. The lectures playlist is not your course. So make sure you follow the syllabus. Follow the syllabus and click into the playlist to watch your videos. Okay? All right. So if you have the gold course, you have the same exact as the syllabus, same exact content. However, this is placed in an LMS, a learning management system. So they don't have to look around for things. In your Discord, there are additional study questions and things like that. But here they don't have to look, it's placed. Everything is placed where it should be. And if you're in this course and for any reason there's something that's not there, let us know. We will get it there as soon as we can. All right. Okay, so now it's time to test your knowledge. And I changed this on the back end. So pretend it says musculoskeletal and respiratory system. No, let's imagine it says that. All right, so we've got true and false questions. This one is on the musculoskeletal system. Let's go. True or false? When a provider performs definitive fracture care, in other words, they're administering a cast, the evaluation and management service is always reported separately. True or false? What say you? And welcome. Couture says she is happy to be here. We're happy to have you. Welcome, George Brown, Alonda, Katina, Health Messages, Sue Cabello. You know what? I'm seeing some new people. Atala. Okay, we got some more down here. Hi, Yannette. Brenda, how are you? Good job, good job, good job. Okay, so someone else says they're new too. Hi, Valerie. Valeria, that's beautiful. In showbiz, almost everyone except one person, I think, is new to me. Hi, Didamore. DC Kicks, how are you? Okay, so I gave you a little more time, and the answer is false because typically your evaluation and management service is bundled into the treatment. Now, while we didn't study that yet, you will learn that it is a part of the guidelines for this musculoskeletal system. But here is a little tip. This word, look at that. That's what I get. It's always. It should be on always. I did some adjustment, but always is your keyword. Very rare is anything in medical coding. Always. Very rare, unless it's just a standard guideline. But always, when you're testing, that should be a clue for you. Good job. All right, so I'm going to pick up the pace. Everybody did really good. True or false? If after the initial cast is applied, then the provider applies a cast or splint during the global period of the fracture, the cast application may be reported separately. So hopefully I'm not disturbing people by talking, but I do want to discuss the global period. The global period is the period that Medicare has essentially said that this is the amount of time that the patient who had that surgery could spend before, how can I say it? I'm going to say it over now. Each code is given a number of days that the patient can receive treatment, like follow up treatment. So if a patient has a fractured arm and let's say they had an open treatment, that code that was used will have a specific number of days that that patient can get treatment for that particular condition and no other um, charges will be incurred. So that code covers all of the treatment within that global period. So global period is the number of days that that patient can receive treatment for that particular code. So CMS determines every single global period. And traditionally, if it's a general surgery, it's 90 days. Some are 120 days, some are 60, but some are 0 days. We'll talk about that too. All right, so someone said they're new. Um, this class is CPT only. So we're discussing CPT. We already discussed ICD-10-CM. That was the first 8 weeks. So you'll have to go to the middle of the section to start. CPT begins at week 9. So we're on week 11. And the cool thing about this course is you can kind of start, like if you've been studying or you're another course, you can just pick up anywhere. But if you're brand new, you have to start at the beginning. You do. All right, so the answer is true. Absolutely true. A lot of you got this correct. Outstanding. I did say I was going to pick up the pace, right? Let's go. All right, true or false? A fracture is considered open for coding purposes if the fracture site is surgically exposed percutaneously for internal fixation. True or false? What say you? Miss Haley said, "You are killing these questions. You are. Indeed, you are outstanding." All right, so if you are not, if you're new to this class but not new to medical coding, let me know. Okay, the answer is false. Absolutely. Either it's open, closed, or percutaneous. So if their site is surgically exposed for percutaneous, um, inter, you know, percutaneous access, then it's not open, right? So when you're talking about percutaneous, the skin may be opened, but it's not open for the sake of treatment. It's open for the sake of accessing the surgical site for the purpose of installation or installing this internal fixation device. If that makes sense, let me know. Let me know. You are killing it. You are, just like Miss Haley said. All right, now we're going to move. We're going to turn our attention to respiratory system. True or false? A provider performs a nasal endoscopy with removal of tissue from the maxillary sinus and a separate diagnostic nasal endoscopy of the ethmoid sinus during the same session. Both procedures may be reported separately because they involve different sinus cavities. True or false? I'm going to read that again. A provider performs a nasal endoscopy with removal of tissue from the maxillary sinus and a separate diagnostic nasal endoscopy of the ethmoid sinus during the same session. Both procedures may be reported separately because they involve different sinus cavities. True or false? Go ahead, type your answers in the chat. All right, the answer is false. You're going to learn that there are two that I know of, two types of endoscopies in the respiratory system that have guidelines associated. And these sinus endoscopies involve the diagnostic endoscopy, involves um, seeing all of the sinuses, everything in the nasal cavity. So we'll talk about that. So it's not a different procedures. So a diagnostic endoscopy includes all of the sinuses. So this is false. And a complete diagnostic exam involves viewing the entire nasal cavity, including all sinuses. Now we learned. Somebody said, damn, you know what? You just had an aha moment. Yes, you did. Outstanding. All right, true or false? A physician performs a percutaneous needle biopsy of the lung under CT guidance and then proceeds to perform an open lung biopsy during the same operative session due to insufficient tissue sampling. Both biopsy procedures may be reported separately. True or false? What say you? Outstanding. Somebody said making a mistake is good. I can learn something. Priceless. Outstanding. 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 Okay, everybody. True. It is true because you've got two procedures going on. One is percutaneous, and then the other is a open procedure. So they did this percutaneous procedure, then they turned around, took a scalpel, and opened the person up. Yeah, two different procedures. Way to go, way to go, way to go. True or false? When a diagnostic biopsy is performed and immediately followed by a more extensive surgical procedure at the same anatomical site during the same session, both the biopsy and the surgical procedure may be reported separately. What? That question looks awfully familiar. Or is it? Maybe it isn't. I think it's so cool that Vina D is here. This is a student that went to every single class that she could go to. This is an MCDC student. She went to the MCDC classes. She went to the YouTube classes. And this student just soared. Also, Vina, when she first joined, she didn't really know. She was brand new, but I found her in the advanced topic classes, and she was not afraid. Not at all, not intimidated at all. And I've watched her grow into this phenomenal, very forensic coder. So hats off. And now she's here today, and I see her in the chat encouraging you. That is the epitome of an AMCI MCDC student. They're not all like that. I'm going to tell you, I'm not even like that. You know, she's a different breed, but that is the vision that we have for our students. And well done. Well done. All right, so this is false. And the reason it's false is because they didn't say that the scope was removed. This patient had a diagnostic biopsy followed by a more extensive in the same site in the same session. In fact, I don't even know if it's a scope. Whatever they did, it's in the same site, same session, same way. So a diagnostic scope is bundled into the surgical scope. So the answer is false because you cannot report them separately. Way to go. Way to go. Way to go. That's right, Amanda. That is right. All right. So my advice, whenever you see diagnostic scopes and surgical scopes, check for that separate procedure next to the code language. That's a telltale. When it's a separate procedure, you do not code them both. No, if they're related. Mm-mm. All right, so well done, well done, well done. Are you all ready? It's time to review a few gems. All right, so for week 11, why am I saying week 12? This is week 11. I'm ahead of myself. All right, so this is week 11. This is what you should be familiar with. You need to be familiar with general CPT coding guidelines, those green page guidelines. Yeah, the green pages in the front of the surgical section. And you should be familiar with musculoskeletal CPT guidelines, familiar with respiratory CPT guidelines. Be familiar with the layout of the musculoskeletal and the respiratory sections within CPT. If you're familiar with the layout, you don't need tabs. So for those of you that are just bothered by tabs and you feel you have to have them, you do not need them. I don't use tabs and never have because I was familiar with my book. And you should be when you're going into your exam, right? Yeah. All right. So the musculoskeletal system, um, you should know. I always say start at your table of contents and you should review the following guidelines. And the reason you need to do it is because there may be some nuances that you should be prepared for before you go to your exam. So if you look at this green musculoskeletal system, there is a green asterisk. Anything with an asterisk next to it, that's a guideline nuance. So read it. But essentially, you should review the following guidelines: your general musculoskeletal guidelines, wound exploration, definitely good possibility you'll be on the test, introduction or removal procedures, and anything with an asterisk. Yeah. All right, we're going through some more. So definitely look at your grafts and implants, head procedures, spine procedures, fractures, yes, and anything with an asterisk. And then anything with an asterisk on this page. In this page, your pelvic and hip joint procedures, definitely fractures, arthrodesis, knee procedures, and anything with an asterisk. All right, and then we're coming to this final page. You see there are bunions might be on your exam, definitely fractures again, arthrodesis is in this section, casts, definitely casts, endoscopy or arthroscopy procedures, and again, anything with an asterisk. Now, I was talking earlier about the general coding guidelines, the musculoskeletal guidelines. Mine are green here, excuse me, white, but I believe they're green. I'm not sure. They kind of change them from year to year, but they could be white on yours as well. But in this section, don't overlook these. You have key guidelines in this area under the general musculoskeletal guidelines. The guidelines on initial casts and removals, the fact that they're bundled is here. Open treatment versus closed versus percutaneous. The clarification is right here. Open, percutaneous, and closed. Also manipulation. Anytime you see manipulation, this guideline says that manipulation and reduction procedures are the same. So when they're manipulating or with force, kind of putting something back into place using force, then that's manipulation. And so too is that reduction procedures. So know those guidelines, and also don't overlook these anatomy pages. There is anatomy and physiology on your exam. Somebody said in the chat, hey, I need to practice my A&P. If you have anatomy in your book, use that if you have anatomy questions. You're not sure? Look at your images. All right? So you got to know where it is to kind of make it applicable. All right? So use your images for midterm and anatomy, and also label as needed. All right, so these are your general coding guidelines. Don't forget it. I think the most important general coding guideline for musculoskeletal and respiratory is separate procedure. So if we didn't do a good job explaining, like we just didn't do it for you, read it for yourself, separate procedure, but it's really simple. People make a big deal out of it, and I think people get confused because there are two conditions. It's not straightforward like this is a separate procedure. No, a separate procedure means a code can be coded by itself or separately. However, if it's in the setting of another procedure, it's just got to be related. Excuse me, it's got to be unrelated to coded. All right. And if it's related, it's bundled. That's it. All right. So now it's time to review. You all ready? I'm waiting for someone to say, yeah, I'm ready. And no one's saying they're ready. Come on, talk to me. Let me know. All right, somebody. All right, Yanette. Okay. Of the following, which best describes the encounter? A, 25607, B, 25105, C, 25607, 25105, 59 modifier, and D, 25608. A 42-year-old male presents with a displaced fracture of the left distal radius. The orthopedic surgeon performs an open reduction and internal fixation with plates and screws. During the same operative session, the surgeon also performs a wrist arthrotomy with synovectomy for pre-existing synovitis. Okay, coders, what say you? Is it A, open treatment, distal radius fracture, extra-articular with internal fixation, or B, excision and curettage, benign bone lesion of the radius and ulna, C, open treatment, distal radius fracture with internal fixation and excision and curettage of benign bone lesion, or D, open treatment, distal radius fracture, intra-articular. Intra-articular means two fragments, and this is with internal fixation. What say you? That's right, coders. You got this. You got it. Okay, coders, what say you? We put the um, code language at the code, so you shouldn't have to look it up. We're actually going to follow this language. So, based on the code language, what say you? All right, let's see. Okay, so this is your first time. This is what we do. We inventory. So, in other words, we write down in the order presented the diagnoses, any signs and symptoms, procedures, and treatments. So, I'm going back up to the documentation and I'm going to start in order. So, displaced fracture of the left distal radius. This is your diagnosis. Then we have open reduction with internal fixation. This is your procedure. And this patient also had a wrist arthrotomy with synovectomy. And this is for something different. So the patient had a fracture and had the open reduction carried out. And you know what? I should have number 4 as your synovitis because that's the diagnosis for that substantiates the arthrotomy and the synovectomy. So I did miss that one. But, it's we know, so it's neither here nor there. All right, so let's go ahead and look up these codes. And I'm going to look up, well, you know what I'm going to do? I'm going to reference a guideline. Like I know in my head that I don't know if I can code both of these procedures. I kind of talked it out, and me talking it out is saying that these two can be coded together, but we really, really separately, but we really, really, I really, really don't know. I would do it, but if you are unsure if you can code two procedures, look for the separate procedure and any parenthetical guidelines. So if you see separate procedure in parentheses, then that means you can't code it together. Okay. So the first code, 2500607, this is the code for open treatment of distal radial extra-articular fracture or epiphyseal separation with internal fixation. I like it. That's exactly what took place, right? Next, we have this 25105. This is the code for arthrotomy, wrist joint with synovectomy. And there are no separate procedure documentation anywhere, right? So we can code them both together. Sure can. So the only code that's coding them both is C. C is coding for open treatment distal radius fracture with internal fixation and excision or curettage of the benign bone lesion. Are you all with me? You know what? Somebody says we have to base it on the documentation. Someone said, "Hey, how do you know if it's internal, excuse me, extracurricular or intra, or excuse me, extra articular or intra articular?" We're not supposed to know it. The documentation is supposed to say it, right? The documentation is supposed to say it. And Mr. Sandeep said, if it doesn't say it, then you have to query the physician. But if you're taking the exam, you just follow the documentation. That's it, right? That's what they want to see us do. Not like think. Like, okay, well, it should be this. We should not be carrying out surgery in our brains. No, our job is to take that documentation and code it according to the um, guidelines, and also making sure that the code you use, the code language, best matches the documentation. Great, great, great. Someone said it's not mentioned. No, it's not mentioned. So we have to choose the best. And typically, we don't have the option to query. Great questions. But in the real world, you do. So get ready. And I know you're not going to have a problem querying Dina, Vina D, man, she kept us on our toes, and I appreciated it. We do. All right, ready? Great job if you got it correct. If you learned something, priceless. Don't be tough on yourself. We were all in that position, all. And if you didn't know, Mrs. J failed her medical coding exam, the first one, not because it was such a hard test, and the test was not trying to trick you. The test was a measurement of your guideline understanding, I believe. So I went back, I learned the guidelines, I taught myself to move very quickly, and I passed. And now AMCI is here, and you all have a much better advantage than me. All right, of the following answers, which best describes the encounter? A, 29075, B, 25605, C, 25600, or D, 25605, 29075. A 12-year-old male presents to the ED after falling from a skateboard, sustaining a closed, displaced distal radius fracture. The orthopedic physician performs a closed reduction under local anesthesia and applies a short arm cast after confirming alignment by x ray. Okay, coders, what say you? And also, too, if you're advanced, tell me if you can eliminate anything on site. I want to know what you know. Go ahead, put your answers in the chat. Okay. Yeah, the answers are coming in. Also, too, if you can eliminate two, go ahead. Tell me how you can eliminate two. All right. So, first things first, look, we're going to inventory the patient. And because I'm a facility coder, I tend to write the facility that they're in, and I write ED, right? So that's just me. You don't have to, but I do it. All right, so the ED patient was diagnosed with a closed displaced radial distal radius fracture, and a closed reduction procedure took place under anesthesia. Then a short arm cast was removed. Now, if you don't know this, you didn't commit this to memory, it might be a good idea to commit this to memory. All fracture treatment bundles The casts. Casts, short arm casts, long casts, all casts. Acrylic, whatever that new stuff it is that they use. But the initial cast and removals are bundled. Those are the only two. Okay. So also, I said to you earlier that manipulation is the same as reduction. And see right here, manipulation. This is the guideline. I pulled it right from the Musculoskeletal General Coding Guidelines, right in the front. Manipulation is reduction by the application of a manually applied force or traction to achieve satisfactory alignment of the fracture or dislocation. So manipulation and reduction are synonymous according to CPT. Now, if that's true, then, well, I just want to say that, but also the closed treatment of distal radial fracture without manipulation would be incorrect because this patient did have manipulation. They had a closed reduction, right? So if they mean the same, then C would be incorrect. Also, if you look at your guidelines, and this is from the perspective of the MCG manual, you go to MCG table of contents, you click on musculoskeletal FTRs, and it will bring you right here. You can see that here are the guidelines. There's like 9, but right here it says bundled into fracture treatment. These are fractures. Initial cast applications and removals are included into the initial treatment. So we're not coding for any casts. And if you commit that to memory, you would have eliminated A because it's coding 29075 for your cast, your short arm cast, and so is D. It's coding 29075 with a treatment code. So both of them are incorrect. And the correct answer will be just your treatment. All right? So just commit to memory the casts are bundled into the initial treatment and the application and the removal of that cast are. And also remember that reduction and manipulation have the same meaning. And if you knew both of those, then B would have been your answer. And if you knew both of those, right, you could have answered all of these questions without looking anything up. Okay. Enough said. Great job. A lot of you got it correct. Outstanding. But nobody told me. Okay. Starry said, hey, casts are bundled. There you go. Outstanding. Outstanding. Okay. We're going to try it again. Of the following answers, which best describes the encounter? A, 27752, B, 27750, C, 27758, D, 27756. A 40-year-old male presents after a car accident with a closed, displaced fracture of the mid shaft of the tibia. The orthopedic surgeon makes an incision to directly expose the fracture site and performs a reduction with internal fixation using plates and screws. Okay, coders, what say you? Is it A, closed treatment of tibial shaft fracture with manipulation with or without traction? B, closed treatment of tibial shaft fracture with or without traction? C, open treatment of tibial shaft fracture with internal fixation? Or D, percutaneous skeletal fixation with or without fibular fracture? What say you? There you go. That's what I'm talking about. Daly said, yes, I'm right on it. Vina D in the chat. And Starry, this is my first time seeing you. I think you are studying already. Good job, good job, good job. Okay, Amanda, everyone's answering. And also, too, if this is your first time, I give people credit for answering, not necessarily I'm not saying that that's the correct answer, but I give credit for answering because I like you to take the initiative. Good job, good job. And Starry said, why? She gave her answer. Okay, Jeanette's coming through. Jeanette and Yanette. Okay, that's what I'm talking about. All right, so here is my inventory. We have a closed displaced fracture of the midshaft tibia. It's a closed fracture. But then number two, I wrote incision was made to directly expose the fracture site. And then the doctor performed internal fixation. So he did a reduction with internal fixation and fracture. Um, Under the fracture and dislocation section, it says there is no coding correlation between the type of fracture and the type of treatment. So a closed fracture can receive open treatment and an open fracture can receive closed treatment. I know. I don't think it's common, but they say there's no correlation. And with today's medicine, anything is possible. All right. So the definition of open treatment means that the site is surgically open to expose the fracture dislocation to the external environment for treatment. So even though the patient, so that's what happened. The doctor incised that site, made an incision to expose the fracture site so that he can perform this reduction and apply internal fixation. So that is why this is an open procedure. All right. So, in other words, the type of fracture has nothing to do with the type of treatment. As you can see, we had a closed fracture and open treatment. So this was kind of easy to kind of figure out. And that is one tip that I want to give you. If you can nail if it's open, closed, or percutaneous, go ahead and eliminate all others. So we know it's open. Go ahead on site. You can get rid of closed, closed, and percutaneous. And our answer is C. Way to go, way to go, way to go. Welcome our new member, Sue Cabela. Welcome, welcome, welcome. You are doing an amazing job. All right. So I think that's all I'm going to review for musculoskeletal. It says we're going to move on and do some gems. So let's go ahead and do the respiratory system and always begin at your table of contents. Now that we know that little asterisk means something, the asterisk, then pay attention. Asterisk means that there are coding nuances associated with coding that particular procedure or section. But for the most part, you'll need to know accessory sinuses. You'll need to know endoscopies. There are specific procedures, endoscopic procedures that have guideline nuances. We're going to see one today. Also, lungs and pleura and lung transplants. These are items that you might see on the exam, and they do have guidelines associated. Your asterisks are key. So if you ever want to know what's going to be on the exam, I would focus on those asterisks, indeed. And also listen to us. We'll if you see a pattern of us showing you specific, if you just see consistently showing you how to code a specific procedure, 9 times out of 10, it's on that exam. Yeah, we've all taken it. Indeed. All right, so here is a gem that I want to give you. And a gem is just like it could be a guideline or just a tip. All right. So when coding respiratory system and knowing those, and these are things that you should know. Not, you don't need to know everything, but you should know this. You need to know the separate procedure guideline. You do. We already talked about it briefly earlier. Also, you should know what is included in a diagnostic sinuscopy, right? You should know. Or you should also know, or what's in a laryngoscopy, right? what does that include? So there are some things, and I'm going to show you the diagnostic sinuscopy or sinuscopy. All right. We're going to do it through a challenge. All right. Of the following answers, which best describes the encounter? A, 31231, B, 3123152 modifier, C, 3123153 modifier, and D, 31237. A 52-year-old patient presents for a diagnostic nasal endoscopy due to chronic sinusitis and nasal obstruction. The physician introduces the endoscope and inspects the nasal cavity and inferior turbinate. However, due to the patient's discomfort, the procedure is terminated. The procedure was rescheduled and anti-anxiety medication was prescribed for the patient to take before the next procedure. Okay, coder, what say you? And you will have to look this up. So I'll give you a moment or two. All right. I know those answers are coming through. I'm going to give you a little more time. Okay, so if you need just a little instruction, you don't need to, you can just kind of look at the screen. Okay, inventory. This patient has a chronic. Where is this cough? What is this? You know what? I don't think I have the right one here. Hmm. All right, so we're going to have to do this on the fly. I asked Chat to change this, so he did. I didn't know he changed all of it. Okay, so this patient has chronic sinusitis and nasal obstruction. Forget about these two, okay? And the patient comes in for a diagnostic nasal endoscopy. What? Hmm. I want to change this. Hang tight because I know I have the correct slide somewhere. Hang on, please. Hmm. All right, I apologize. It just won't update no matter how many times I try and render it. So we're just going to have to just wing it if that's okay. All right, so let's do this. Okay. All right, so sorry about that. It won't, it's just kind of sitting there. Okay, so we have a diagnostic nasal endoscopy taking place. The patient has chronic sinusitis and nasal obstruction. Then the procedure, for some reason, was terminated because the patient couldn't tolerate it, and they only got to inspect the inferior turbinate of the nasal cavity. That's it. And then they rescheduled. All right. So I went to go look up the code, and sitting right on top of 31231 are some guidelines. So this is a great opportunity to read them. And that's what I was explaining earlier. I said, hey, make sure that you're familiar with sinus endoscopies and laryngoscopy, because those diagnostic endoscopy includes some things. So if a patient has um, a diagnostic nasal endoscopy or of the sinus, they have to inspect the interior of the nasal cavity and the middle and superior meatus, the turbinates, and the sphenoethmoid process. So all of that has to be done. Anytime it's performed, all of these areas must be inspected. Now, if it can't, for any reason, that procedure is terminated, you will need to append modifier 52 or 53. Modifier 52 if another procedure is not planned. Modifier 53 if a repeat procedure is planned. And this is where you get the guidelines. Now, for those of you that have the MCG manual, we already pulled out these guidelines. Just go to your MCG manual, click on respiratory FTRs. It's sitting right there. All right. So essentially, here are your gems. All of the interior nasal cavity must be examined, or you have to use modifiers 52 or 53. And remember, 52 is unplanned return, 53 is a planned repeat procedure. So, knowing this guideline, we know that the answer is C, right? It's C because it's the only one with modifier 53. And if you wanted to do your due diligence, 31231, this is the code for nasal endoscopy, diagnostic, unilateral or bilateral. So you're supposed to know what this is includes. So if you want to put yourself a little note here, you know, a um, full nasal cavity be must take place, or whatever you need to write there. I know that's right, Kathy. And 31237, this is the code for nasal sinus endoscopy surgical. So this is not a diagnostic, it's surgical with biopsy, polypectomy, or debridement. Now, another thing, a tip that I want to give you, um, I would box. You know, if you watch my Chun lectures, I'm talking about boxing things, boxing key terms. I would box diagnostic and surgical, or just one of them, just so it stands out. Diagnostic is not surgical. And when they are carried out at the same time, look at this. Both of these are separate procedures. So if they're carried out with some extensive procedure, these anyway, they're not coded they're not coded if it's related. Not to get off task. I don't want to do that. But I do want to just commend all of you who got it correct. I see you. I think that was everybody. Outstanding, outstanding. So maybe too much. Look at that. You guys are amazing. That's right. All right, so let's go ahead and let's close it out. And I just want you to remember that you do not have to remember guidelines, just that they exist. not all things. I'm going to say, hey, remember this. It's good to know this. And if you don't, it's okay. Just know where the guideline is and you're good. Also, don't forget, well, not Tuesday nights, on Friday nights. Tuesday nights, Mr. Sandeep has a private class with MC DC students, but Friday nights with Mr. Sandeep, check him out. You're gonna really really appreciate him and the way he breaks down these scenarios. Also, use the YouTube video catalog for specific guidance. Also, never use an encoder. An encoder will thwart your independent coding proficiency while you are studying for the exam. Now, in the real world, use that encoder. But before then, don't get in the habit. You got to be able to quickly get a rhythm for answering the questions. This is a time-based exam, and it is no joke. A lot of people do not finish because they don't have the rhythm. So let's just go ahead and follow this, and you're going to be good. Also, never ever use blind process of elimination. If you don't know what it is, I'll be demonstrating it again. But it's, a technique that some instructors, legitimate instructors, are teaching you to use. And you cannot use that blind process of elimination in the real world when you take your real world medical coding proficiency exams. You can't. So it's useful for the exam in some cases. It will give you an 80%, 85% chance of how can I say? You can't get over 85%. You're at a disadvantage because there's going to be some questions that don't follow that rule. I'm like, I wouldn't even start. Everybody starts with a 100% chance. 100%. You have a chance to get 100%. You have a chance to get 80%. I don't know anyone that's taken used blind process of elimination, scored over 85 because they can't statistically. So there's going to be some outliers, but it's not possible. Mm-mm. All right, 2026 guidelines will always take precedence. So if you want to know, if you see an older AMCI video and there's a discrepancy, just in your book says something different, just know your book will take precedence if it is 2026. Okay. Also, if you are purchasing or planning on purchasing the AAPC Practicode, take your Practicode after you've passed your medical coding exams because those questions could thwart you. It's those questions are not on the exam. Yeah. And if you got that correct, and this is chat, we do use chat to generate a lot of our content, and it doesn't spell correctly, and they make a lot of mistakes, but it's expected. But if you learn something, coders, if you learn something, that is priceless. Now, I got some final words. Try to complete your week 12. This is for next week, okay? Try to complete everything before class. And this is the syllabus. And also, if you're a gold online course member, just follow your LMS in order. And it looks like this. And they don't have anything different. They don't have the MCDC course. They do have their quizzes in there. We put a few quizzes in there for them, but um you don't need to have the gold course, so we're not selling that. It's just a preference, okay? Now, I do want to tell you about the video catalog. The video catalog, these are AI generated videos. However, this is AMCI content that was generated by AI. So it's technically not all AI, right? So we took our content and put it in AI and they're doing an amazing job. I don't see too many errors. There's some, but not too many. But why I like it is that it breaks down each section. So each section they have guidelines, it breaks it down. So you don't have to look at all of the videos. You can go directly to what you need, right? So if you want to, instruction on skin biopsies, this code series, just click that. And it's not free. You have to pay. There are some free videos that everyone can have, but you do have to pay at least the $2.99. So these are member only benefits. So definitely make sure that you've done that. And in addition to having this, you also have access to Discord. So there's some benefits to that minimal $2.99. Okay? All right. Come on. Now, final tips. All right, here you go. Remember, this class is not for instruction. So if you walk away saying, "Oh, she didn't teach us. She didn't, kind of walk us through." It's not meant for that. It's meant to augmentate what you've already learned. And also I want to hear if I want to be here so I can know what you need. Yeah. So if you have anything that you want or need, put it on the survey if you couldn't get it in the chat, okay? Um, Also, again, remember that you don't have to remember guidelines, just that they exist. Make sure you attend the Friday CPT guideline class with Mr. Sandeep. Make sure you go to A&P with Ms. Mills in Discord. And on Monday, still go to ICD 10CM. Keep that sharp with Ms. Haley. Use Quizlet to study guidelines if you need to. Again, don't use that encoder. And I already said that. I'm repeating myself. So I just want to let you know that I would very much appreciate it if you take a moment to complete the survey. That's all I ask for. That's it. So if you can do that, that would be helpful. So my team put the survey in the chat. I don't think it's clickable, this survey. So you might have to copy and paste it if you can. Yeah. Miss Star Wars girl said, "Hey, we're accountability for what you've already learned." Indeed, that's what we're doing. But you know what? You wouldn't believe the number of people that say, not a lot, say, "Hey, I need Miss J to walk it through." I hear you though. Is not here though, but I hear you. Okay. Thank you, Vina D. Congratulations. Well done, well done. I remember her first day here. I do. And it wasn't here. We were in Discord. All right. So, does anybody have any question? Oh, yeah. Somebody said, don't forget Friday Night Live. Yes, it's fun. It's fun learning. And you get to kind of meet other coders and the instructors and interns. So, definitely come on through. And thank you, Alonda. Thank you all, Amanda. Jeanette, Casey. I see that. Is it Casey Lees? Okay, I love it. Jerry, good to see you. He said hi. Can't respond, but hi. All right. So thank you, team. Thank you, Mr. Sandeep. Thank you, Ms. Mills, Miss Haley, Miss Beth, Miss Star Wars Girl. You all are amazing. So please complete the survey and we'll see you next time. Outstanding. We love you too, Brenda. Indeed, we do. Lest we forget, thank you. All right, everybody. Thank you, Miss Mills.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around.